What's up, everybody? Today we're checking out Emergency Room Simulator. It's a relatively new game, just came out, I'd say, within the last week. And yeah, I've been waiting to get this into the schedule here. So why don't we go ahead and give it a try? Okay, we got Emergency Room Simulator. Alright, new game. Let's jump into it. I'm gonna be a doctor today. Okay, okay, WASD, got it. Okay. Let's take a look around real quick. Alright, let's go on. Let's do the tutorial here. Follow the lines to room A22, because that's the stock room. Enter the room and step into the marking area. Or the marking there, rather. Alright, maybe. Seems pretty empty in here. What's going on? Where is everybody? Oh, here we go. How you doing, ma'am? Alright, we got some patients. Alright, A22. Okay, in this room, every patient is examined using the available medical equipment. The initial treatment is also performed. Take a close look at everything here and take your time to familiarize yourself with the options marked with a question mark. Okay. Send the blood sample to the lab. No blood sample selected. Okay, what is this? So this is blood transfusion. This is where the infusion bags with blood are stored. If a patient needs blood, they can take a bag and hang on the IV stand on the stretcher. Okay, stethoscope is a medical examination instrument used to listen to the body's sound. Add it to your inventory. Okay, we'll take that. Disinfectant can be used to sanitize parts of the body. It is useful for preventing infections in open wounds and cuts. Okay. Alright, so it looks like we can possibly hold 3 items. Oxygen mask is a medical device used to deliver high concentration oxygen to a patient. The mask covers the mouth and nose. It can be added to your inventory. Alright, what is this? Defibrillator. It's a medical device used for okay, literally. A device delivers electrical current, yes. In the event of cardiac arrest, you use that, okay. Administer an electric shock to the patient. Place apex and sternum electrodes, okay. We don't need that yet. Ultrasound. The ultrasound machine is used to perform the ultrasound and examination imaging technique based on sound waves. You can select a probe position in place. Okay. Okay, so we got heart, we got lungs, kidney, subcostal. Okay, different things. So we got different sections here. Okay. Interesting. Okay, ECG stands for electrocardiogram, which is the term for the recording of the electrical activity of the heart muscle fibers. Okay. Alrighty. Interesting. Let's go ahead. Let me just do something. 1 sec, guys. I need to test something. Okay, here we go. Familiarize. Yes, okay. All right, telephone. You can use the telephone to schedule a patient for further examinations. The patient must be informed. Oh, you can also like send them like other departments. Okay. Okay. Interesting. Alrighty then. Alright, so we got registration. Okay, there's a bunch of different things here. Okay. And we got more. Medications. Here you'll find medications. There are oral medications that the patient has to swallow or IV medications. Okay. Okay, there's IV meds, oral meds. Okay, what do we got here? Puncture. The puncture needle used to perform a puncture is isolated here in an emergency. Get the puncture needle from the drawer and puncture the patient at the marked spot. Syringes? Okay, syringes. Here you'll find syringes for combining the injection IV medication as well as laboratory tubes for blood collection. Infusions. IV fluids. Here you'll find the infusions you can administer to the patient as needed, as well as empty infusion bags that can be combined with IV medication. Okay. Bunch of different stuff there. My goodness. Listen, I'm not a real doctor, okay? Take it easy on me with all this stuff. Needle and thread. Here you'll find needle and thread, which are needed to sew up wounds and cuts. Okay. Now you'll get to know your tablet, which is absolutely essential for your work here. The 4 main sections from left to right are patient file, test results, archive, and profile. Open your tablet now. Okay, we got patient file, test results, archive, profile. Okay. Man. There is so much going on, and I haven't even started. This is kind of wild, actually. So much going on. Haven't even seen a patient yet. And I'm already, Now you gained a first overview here in the stockroom. However, you will also need to use radiology for your examinations. It is located directly opposite the shock room in A25. Okay. Well, that looks like A26. This is radiology. Oh my goodness. I don't think I can handle this. This is too much. This is too much work. What the heck am I supposed to do? This might be too much for me. But we'll give it our best here. We certainly will. Alright, just give me a sec here. I seem to be constantly running into new problems for some reason. But I think we're good. We'll just chug along here. We'll just chug along. Alright. In front of you in room A26 with the X-ray machine. Enter it now and get to know the X-ray machine. Boy, I think this hospital's gonna get sued with me here. I really think so. X-ray machine. An X-ray examination is performed with an X-ray machine if you need to do such an examination later. Place the stretcher with the patient in the marked area and undress the patient. Now go back to the hallway and then into room A24 because that's where the CT scanner. Okay. Alrighty. Okay, a CT scanner is a medical device used to perform a computed tomography scan if you need to do such an examination later. Place the stretcher. Yes, I gotcha. Between the two rooms, A24 and 26, is the control room for radiology. In room A25, of course, there are also direct connection doors, so you don't need to always have to go to the hallway. You can now familiarize yourself within the premises. Alright, control room. In radiology control room, you perform and monitor the examinations of X-ray machines and the CT scanner. You can trigger the X-ray on this computer as long as the patient is undressed on the stretcher and is placed in the marked area. Okay, same thing here. Once you have a look around, go back to... I feel like all of this stuff should be explained to you. Hopefully it is again. Like when you're actually doing the test for the first time. Instead of just dumping everything on you. Holy crap, man. Attention, an emergency room. Run to the entrance and speak with the paramedic to take a patient. Quick. What's going on? Where's the paramedic? Oh my goodness, what happened? Select the briefing. Like, a briefing on the physical examination conducted by the paramedics. The patient has a wound on the left lower leg. Vital parameters. The vital parameters are still within normal range, only the blood pressure is somewhat low, and the pulse is slightly elevated. Brief. We were called to an injury on the leg. We were already able to stop the bleeding. Alright, let's take him in. Alright, ma'am, you're coming with me. Don't worry, I'm gonna save your life. You're not gonna lose your leg. Okay, we're almost there. Just hang with me, lady. Don't worry, I'm a professional. I'm a doctor. Crap, I can't even stare this freaking thing. Alright, there we go. And now what? Now the pre-examination is being carried out. Select the patient interaction. What? Select patient interact. Okay, let's go ahead and do this. What the frick? Select interview. Okay, it's telling me what to do here. Interview. Ask the patient all 7 questions. Alright, tell me about your family medical history. No, nothing I know about. No heart diseases. Alright. You got any pain? No, the pain is only localized in the area of the wound. Okay. Are you bedridden? No, I was not bedridden. Okay, ma'am. How about this? Have you had any recent physical trauma? Yes, I had an accident and sustained a cut on my leg. Okay. I don't even know. I don't even know what the hell that is. Alright, when you breathe, does it hurt? No, I don't have any pain when inhaling or exhaling. Are you excited or are you scared? Well, I'm a little worried that I might get infected. Okay. Alright, select the pre-examination category on the right. You can see the patient's answers, which you now tap and enter on the left side of the tablet. If all answers were transferred correctly, finish the pre-examination. Okay. Not known. No pain, radiation. Bedridden, no bedridden. Physical trauma, they had an accident. Thrombosis? Embolism? I don't even know what the frick those words are. But no. No breath pain. No dependency. Excited or fear. Concern, not fear of death. Okay, we've concluded that. Now open the diagnosis. Oh, here we go. Diagnosis. Here you can see all the possible diagnoses that fit the pre-examination. Diagnoses need to be backed up in order to be sure what disease the patient has. To find evidence, you have to carry out examinations. Now choose the diagnosis, cut, and try to prove it with further tests. Okay. Let's try to prove it with further tests here. Okay. We'll get back to that in 1 second. Alright, let's go ahead and try to prove what we can prove. Cut. I'm sorry, what? Cancel. Cut. Substance. Undress the patient, look at the body. Okay. Undress the patient. Now we can look at the body. There we go. Wait, what am I supposed to do here? We looking at the lower leg? What the hell's going on? Here we go. Let's look at it. Okay, we already looked at it, I guess. I don't actually know what the heck. Can I get out of here, please? Can I please get out of here? I don't know which one it is because I don't know. Come on, man. Let me leave this tablet, please. Brother, can I just examine her one more time, please? I don't know. Cut on the lower leg, I guess. Can I undress the patient, manually examine the lower leg? Okay. Compression. I just want to close the tablet if I could. That'd be great. No? Okay. Ask the patient. Okay. Seems as though I just can't do anything here, which is unfortunate. Maybe I'm just missing something, I don't know. Compression. Oh, diagnose and conclude. Jeez, man. I just wanted to go back to like look at her. A wound. Diagnosis not successful. Alright, treatment maybe? Oh my goodness, brother. Kind of annoying. I wanted to look at it again. Alright, anesthetic out of the cabinet. Okay, where is that? Where is that located? Anesthetic. I don't know. I don't know if this is the correct thing I'm supposed to do here. I gotta be honest, unless you actually know this kind of stuff, like, it's kind of difficult. Wait, where the hell? Where's the thing that I need here? The tutorial could be a lot better for people that don't actually, like, know what they're doing in a hospital. The tutorial's not very friendly to people that don't know what they're doing. I gotta take the something out of the closet, take the syringe. I got the syringe. Combine the syringe. That's decent. That's a puncture needle. No. IV meds, no. It says out of the cabinet. Which freaking cabinet? Anesthetic? I don't know what the frick that is, man. Help me out here, brother. Talk to me like I'm an idiot, please. That would be great. Just treat me like I'm dumb. I'd love that. Because I don't know what the hell I'm doing. I ain't a doctor. Alright, because I didn't remember everything that they taught me at medical school, I'm gonna have to look some stuff up. It's a drug. Okay, thank you. Alright. Drugs. Right there. Here we go. Combined it. Syringe? No filled syringe. Okay, maybe I have to have the syringe selected. No filled syringe. How do you syringe it? Or how do you combine it, rather? Damn, dude, I gotta tell you, I hate, hate when tutorials are trashy like this. I gotta be honest. I apologize, but I don't find this tutorial very friendly for people that don't know what's going on. Alright, I have the syringe, right? Do I combine it somewhere? Alright, let's see. It wants me to combine them. Yes, I know that, but how do I combine them? Hey lady, do you know how to combine them? Because I sure don't. Combine the syringe. I have the syringe. I have the medicine. Okay? I have it. I really, really do. Right, and this is the one that I need. Is there like keybinds or something? No. Oh my goodness, brother. Alright, maybe we'll give them some ibuprofen instead. How about that? Ibuprofen. Hey, take these. Here, please take the tablets. There you go. Inject syringe. No syringe selected. No filled syringe selected. Okay, how do I combine the medicine with the syringe? Syringes and infusion bags need to be combined with IV medication first. If you have an empty syringe or infusion bag, the IV medication in your inventory Okay, syringes and infusion bags need to be combined with IV medication first. If you have an empty syringe or infusion bag and the IV medication in your inventory, open the inventory. Okay. I swear I was trying to hit I before and nothing came up. I'm telling you I was hitting I and nothing came up. I think maybe it wanted me to do the ibuprofen first, and then it wouldn't let me do anything else until I did that. My goodness, man. It's insane. Alright, Jesus. Take the disinfectant from the rolling cabinet and disinfect the wound. It's already disinfected, brother. Alright, close the wound. Take the needle and thread out of the cabinet. Close the wound. Needle and thread. Let's close the wound. Okay, here we go. Closing the wound. Okay, let's grab some bandages. Just gotta bandage that. Alright. Hey, what's up, Karsten? Alright, we gotta take the tetanus vaccine out of the cabinet. Is it in here? There we go. Now, take a syringe. Open the inventory. Combine with the tetanus. There we go. Now let's give her a tetanus shot. Hey lady, you ready for your tetanus shot? Okay, there we go. Now what? Select registration aftercare on the phone. The phone? Registration aftercare. Right here. Inform patient about the transfer to aftercare. Ma'am, I'm gonna transfer you, okay? Take the patient to the elevator. Wait, should we put her clothes back on? Alright, maybe not. I don't know. Sorry, ma'am. Going through the hallway half naked over here. I'm sorry. I'm so sorry, ma'am. I don't know how to drive this thing. I'm sorry. Jesus. Okay, we made it, ma'am. We made it. We're just going to the elevator. Do you have any family you want me to call? Hold on. There we go. I'm gonna pass you off to this nice gentleman, okay? Have a good one. My goodness, that was the most difficult thing I've ever done. This tutorial is not very friendly. Alright. Next step, treatment complete. That was crazy. Absolutely crazy. Oh my goodness. I feel so dumb after doing that tutorial. Alright, congratulations. First treatment of an emergency patient has been successfully completed. Go back to the shock room. You certainly won't have any peace for very long, because the next emergency is sure to come. Okay. We got a new emergency. Oh my goodness. What happened? Was he shot? Is he dying? Alright, let's get a briefing. The patient looks a bit pale, but no external injuries or abnormalities. Alright, you take their vitals. We measured low blood pressure and an increased pulse. Okay, tell me some stuff. We were called due to chest pain. Additionally, the patient is having difficulty breathing. Alright, I'll take it from here. I'll take it from here. I know exactly not what I'm doing. Sir, don't worry. You're not gonna die, okay? Not on my watch. You're gonna make it. I promise you, you're gonna make it. Just hold on a sec. I'll get you in there. Yeah, just give me a sec. Okay. Oh, hold on. Yep. There we go. Perfect. Okay, sir, I'm gonna ask you some questions, okay? You have any, family, illnesses? My parents are enjoying their retirement. My grandparents are dead already. Okay. Do you have any pain radiating through your body? No, it's just the chest. Okay, are you bedridden? No, I've been on the go all day. Do you have any physical trauma? No, I'm a cautious person. Okay, I don't even know what these words are, but I'm gonna ask you anyways. No, couldn't remember that. I don't know what it means either, and I'm a doctor. Alright, do you have any breathing pain? Yes, that is extremely disturbing, especially when inhaling and coughing. Okay, sir, are you excited or do you fear for your life? Fear? Me? No, I'm good. I'm in good hands with you. Yeah, okay, sure. I'm glad you have confidence in me, sir. Okay, so we interviewed the patient. Now we have to check these. Alright, cancer diseases. No heart diseases. Pain radiating. No pain radiating. Bedridden. No. Recent physical trauma. No. Whatever this is, I don't know, but no. When he breathed, it definitely hurts, increased pain when inhaling and coughing. Excited or fear? No, because he's with the best doctor in town. Let's go ahead and conclude that. Now we're going to diagnosis. Rib fracture. Okay, let's undress the patient and look at his body. Sir, I'm gonna have to undress you, okay? And I'm gonna look over your body. Look at the body. There are no noticeable abnormalities. Okay. Let's see. Visual inspection. No abnormalities. Alright. Should we be looking at this or should we be looking at a heart attack first? I feel like that might be the... Man, there's so many different things it could be. It must be crazy being a doctor. Holy crap. I could never do this. Let's do this. Let's, am I still under rib fracture? I am. Okay. Let's check compression of thorax laterally. Yeah, because I know what that means. Let's look. No. Compression? No. Crap, I don't know what I'm doing. Manual examination of chest. How do I look at the chest? Okay, I don't actually know how to do that. Should we use the defibrillator on him? Yeah, EKG. You want an EKG? Yeah, let's do some EKGs. Or ECG. Okay. We should probably not be doing this now, but we're gonna do it. Did I do it right? Record. Let's show printout. Looks rather inconspicuous. Okay. Turns out, sir, I don't know what I'm doing, but we'll figure it out eventually. Hopefully you don't die in the meantime, okay? Alright. Let me look at my notes again. Man. Let's do an x-ray. You wanna do an x-ray? I don't think that's gonna work. I'm trying to do this manual examination of the chest. I don't know how to do that. Oh, here we go. Maybe this helps. I don't think that's supposed to sound like that. Oh, the heart sounds unremarkable. Okay, never mind. Very strange. It almost seems as if the right lung is not active. Okay, so the heart was fine. I just don't know what I'm talking about. The stomach sounds normal. Okay, so... the lung. There's something wrong with the lung. Undress the patient. Pick up the okay. And look at the lungs. I feel like I've already done this. Very strange. It almost seems as if the right lung is not active. Okay. Right here. Weakened sound, rattling. No breath sounds on the right side. Is that the correct thing? Yeah, I think that is no sound, right? Let's go with that. Crap, dude. I don't know what I'm doing. Let's try this one. Alright, we already did that with the heart, right? The heart sounded fine. Normal findings. Now, what is this? Compression of the thorax laterally. I don't actually know how to do this part. Look at patient. Compression. Feels normal and no pain reaction from the patient. Let's try that again. Compression side. Compression, no abnormalities. I think that's fine, right? X-ray. Okay, sir. We're going for an X-ray, alright? Listen, you're gonna be fine. Hopefully you're not having a heart attack, because after 10 minutes, you're probably gonna be dead. You're gonna make it, alright? Which one's the X-ray? This one. Sir, you just hang on, okay? Excuse me. Yeah, how do we go sideways? Oh, shoot, I'm sorry. Hold up. Oh, stop. How do we get him on here? Okay. Now what? Can somebody help me? Patient. God dang it. I don't know what I'm doing. He's gonna die on me. Sir. Maybe I go in here. X-ray. Take X-rays. Oh, there we go. Okay, we just leave him in there, and then he automatically gets teleported onto it. We might save this guy's life after all. Okay. I should take a closer look at it. X-ray. Take an X-ray. No. Treatment. How do I look at it? View the X-ray image on the tablet. X-ray test results right here. That looks like a lung collapse. Okay, we figured it out. I think we figured it out. Lung collapse. Diagnose and conclude. Okay. Next step, complete diagnosis. We already did that. Ask the patient about family. No, that's not what we're doing. Okay, it's definitely concluded. If that's concluded, what are we doing? What are we now doing? Right, diagnosis concluded. It would probably be... Do we have to, like, do all of these things? Maybe we have to complete everything. Okay. Lung collapse. Blood test D-dimmer? D-dimmer? I don't know. Okay, pick up the blood. Alright, sir. Can I take blood from here? Yeah. Pick up the blood container. Actually, you know what, sir? Come with me. We're going to the other room, okay? I'm more comfortable in the other room. Okay. Pick up the blood container. Blood container. Blood container. Take blood. How do we take blood? Take blood. Um, syringe? Eye? Blood container? No. Infusion? No. Puncture? I don't know. Alright, patient medication? Syringe? No. We're not giving a medication. Storage? Fill the blood container at the access. No blood container select. Okay, here we go. Alright, let's take some blood. Alright. Check the blood values on the tablet. Okay, send the blood to the laboratory. Send blood. The results of the blood will certainly be sent to the lab. Okay. A blood test. Here we go. I don't know what any of this means, but it looks like it's all in the green. And that means it's good. All blood values are within normal range. Okay. So his blood is good. Let's go back here. Normal range. Normal range. Diagnose concluded for this. Now... Okay, so it is a lung collapse, right? Now we have to go to treatment. Okay. Let's take out some medicine here. We need anesthetic. Right there. I think I actually have some. I already have some. Okay, we have it already. Let's combine the syringe with the anesthetic. Okay, and then we'll give it to him. There you go, sir. I'm gonna give you an injection now. Don't worry, you'll feel better quickly, okay? I'm a professional. What? Lung puncture? What? Emergency? What do I do? Take the disinfecting from the rolling cabinet? What? Take the puncture needle out of the cabinet? What's going on? Holy shoot. Disinfect the puncture area. Shoot. Where's the puncture area? He's gonna die. He's gonna die. Disinfect the area. Okay. Take the disinfection out. Yes. Take the puncture needle out of the cabinet. Yes. Disinfection. Lung puncture. Let's puncture that bad boy. Okay. Advise the patient on the next step. Okay, I think I saved his life. He was almost gonna die on us. I almost lost my first patient. Jesus. Advise the patient on the next steps. My goodness, your lung has partially collapsed because air has entered the chest cavity. This is... I can't read that fast. Okay. Select registration on the phone. Okay. Man, I can't believe we almost lost him. Okay. Bring the patient to us after your treatment. Okay, sir, we're gonna transfer you, okay? Alright? I'm glad I could help you today. I almost lost you, but... but we're okay. Bro, I can't even imagine, like, a real doctor in that situation. How calm they have to be. My goodness. Yo, doctors are awesome. That's all I gotta say. Especially in, like, the emergency room. Alright, sir, you're in good hands. Maybe I should have dressed him. Maybe I should have put his clothes back on. Alright, treatment completed. Excellent. I completed this in 51 seconds. Okay. Alright, that was cool. New patient is waiting. So, in the beginning during the tutorial, I was having an issue. Like, it was very difficult. And there was just so much stuff, like, thrown at me at once. It was very confusing. But now things are starting to come together here. How you doing, ma'am? What's going on here? Why don't you give me a briefing? The patient looks a bit pale, but has no external injuries. Okay. Did you take any vitals? We noticed, yeah, okay, in the ECG. Can I get that information again? No? We were called due to headaches and dizziness. The patient reports feeling tired and weak. Alright, I'll take the patient from here. Ma'am, are you ready? I can see you now. Why don't you come with me? Please go to room A22, okay? We're gonna get you taken care of. Right this way, right in here. Okay. And why don't you, Exactly. That's what I was gonna say. Alright, ma'am, I got some questions for you. Has anyone in your family got any issues? Yes, my grandma had heart problems and had to take pills. Do you have any pain radiating in your body right now? I don't actually have any pain, just dizziness or weakness. Okay. Have you been bedridden? I have been in bed a lot lately because I constantly feel tired and groggy. Do you have any physical trauma? No. Okay, I still don't know how to pronounce these words. But how about it? Do you have this? No, I've never experienced anything like this. I wish the answers would like give me a clue on what it is. I don't know what these are. Maybe let me just check them. Let me look them up real quick. Okay, what is it? It's a stationary blood clot that forms inside the blood vessel. Okay. And then when the clot breaks loose, it travels through the bloodstream. Okay, so it's basically blood clots. Okay. Okay, that's good to know. So that's what that is. I'm gonna start asking, do you have any blood clots, instead of trying to pronounce these words because I'm an idiot. Alright, ma'am, when you breathe, does it hurt? My complaints have nothing to do with breathing. Alright, lady, I was just asking you a question, huh? Jesus. You don't gotta give me an attitude. Alright, are you excited or do you fear for your life? Well, it's of course very worrying. A lot is going through my mind, but it's not really fear of death. Okay. Okay, ma'am. Thank you for answering my questions. Alright, let's fill this out. No cancer, no heart disease. Oh wait, cancer with heart disease. Okay, that's important. Pain radiating, no. Bedridden due to fatigue. Physical trauma, no. Blood clot, no. Breath dependent pain. Chest pain, not dependent on breathing. Okay, and concern, but not fear of death. Got it. Let's go ahead and diagnose. What could this be? Kidney failure, that'd be rough. What do we start with here? I think I'm actually gonna start with kidney failure. Alright, visual inspection. Undress the patient, look at the body. Okay. No abnormalities. Okay. No abnormalities. Okay, let's check out the heart. The lungs. Okay, let's check it out. Lungs. Sounds normal, at least the lung is uninjured. One clearly recognizes a slowed heartbeat. Okay, so they have a slow heartbeat. The stomach sounds normal. Okay. The heartbeat was slowed. The lung. I think they said the lung was fine, right? Yeah. Alright, let's do some blood tests. Blood container. Crap, I forgot how to do this. Do I need a syringe? Wait, and I combined, yeah? No. I forgot how to do this already. I just did this. I just did this. Oh wait, it wants me to do something else, that's why. Okay, so it wants me to do the ultrasound first. Okay, that's why. Alright, let's grab the ultrasound. A cardiac ultrasound. I mean, this is a heart. Wait. Yeah, that's an ultrasound. Alright. No abnormalities. Let's do this one. I think it was no abnormalities, right? No abnormalities. Now let's do a blood test. Blood test. Oh, that's right. This is how you do it. You gotta go to the storage and preparations, then you do the fill the blood container. Okay. There's just so much to do, it's hard to remember it all. Alright, let's send that blood. Okay. Let's check the report here. Is this hers? Is this her? Yeah, this is her. Okay, everything looks good. Everything's in the normal range, right? Electrolytes. And, okay, let me check it again real quick. Electrolytes. Huh. Alright, I think it's fine. Everything's in the normal ranges. Now let's do a CT scan. Alright, man, we're gonna go do a CT scan, okay? Right this way. I'm gonna put you right here, I'll be right back. Let's go ahead and scan her. Alright, she's done. Let's go ahead and look. Can we look at that? No. I think we look at it from here. Yep, CT scan. No abnormalities. Okay. So it's not... It's not that. So it's not kidney failure. It's probably not electrolyte, right? Because we already did all of this. That's complete. Let's go... I hope she's not having a stroke, because she'd be done. Let's do slowed heart rate. Blood's in normal range. We're gonna do ECG on her. Man, we're gonna go back to the other room, okay? Alright, right here. I'm sorry, I didn't mean to bump into that. I did it again. I apologize. I am not very good with these stretches. Oh, that's not gonna work. Well, let's get you tucked in there. I'm so sorry, man. Please don't sue me. Alright, well, we'll do this one more time, okay? We'll take a nice wide turn. And we'll get you in there. Okay, we're gonna do a ECG, okay? Just gonna place these on here, stick a few of them. Okay, then we'll connect them with some wires. And we'll run the scan, okay? Alright, what do we got here? One clearly recognizes a slow heartbeat. Okay, we got a slow heartbeat. Slowed heart rate. Okay, so it's going to be the slow heart rate. Treatment. Administer adrenaline. Alright, ma'am. Oh, let me, yeah, let me take these off of you. I apologize. Okay, adrenaline out of the cabinet. There we go. Let's take some adrenaline right there. We're gonna combine it with the syringe. And then we'll inject her. There we go, ma'am. You're gonna be amped up. You're gonna run through a wall after this. Select, crap, what do we need to do here? Select registration intervention on the phone. Intervention. Inform the patient about their transfer to the intensive care unit. Holy crap, lady. You're not gonna make it. Ma'am, ma'am, we're gonna transfer you, okay? We're gonna... You're gonna go to the ICU. Yeah. You might not make it till morning, but at least you're in good hands. Okay, you might get a concussion from all of this, too. But we got doctors for that. Okay? We got drugs and doctors for it. You'll be fine. You're gonna do great. Alright, here's the elevator. I'm gonna pass you off to this nice gentleman. It was, it was nice being your doctor for... Oh my god, oh no. Oh. I thought she was gonna die in there. The elevator was gonna crush her. Alright, what country? What country is the emergency 112? Where I am, it's 911. Wonder what country this is. Okay, treatment complete. That's concluded. Alright, no active patient. Man, look how... This hospital looks like amazing. Look at this. What a nice hospital. My goodness. Alright, tell me what's going on. The patient looks a bit pale, but no external injuries or abnormalities. We noticed something wrong in the ECG and measured elevated blood pressure. We were called due to headaches and dizziness. The patient reports feeling tired and weak. Alright, I'll take it from here. Sir, you're in great hands. I am Dr. Searchlight, and I'm gonna take care of you today. Okay? First things first, I'm gonna take your clothes off. No, it's not that kind of place. Sir, I'm sorry. I'm sorry if this is giving you... If this is making you more dizzy, I apologize. Actually, before I take your clothes off, I'm gonna ask you some questions. I'll get to know you first. Does your family have any medical history? Yes, my grandma had heart problems. Do you have any pain radiation? I don't have any pain radiation, just dizziness or weakness. Okay. Have you been bedridden? You've been in bed lately because of tired and groggy. Okay. You know, I just had a patient just like this. No physical trauma. Alright, do you have any blood clots? No? When you breathe, does it hurt? My complaints have nothing to do with breathing. Okay, are you, nervous or do you fear for your life right now? Well, of course it's very worrying. I got a lot going on, but no fear of death. Okay. Okay, thank you for answering those questions. You got cancer, no cancer, heart disease, no pain, bedridden due to fatigue, no physical trauma, no blood clots, chest pain, not dependent on breathing. And you're concerned, but you don't fear of death. Okay, thank you. Alright, so this is the same... This is like the same issue as the last lady. So, let's go with electrolyte disorder first. We'll try that. Okay. Visual inspection. Let's do a visual inspection. No abnormalities. Okay. No abnormalities. Now, let's check the heart and the lungs. Sounds normal. One clearly recognizes a slow heart rate, or heartbeat rather. Let's just check the stomach while we're here. Okay, stomach sounds normal. Okay, let's lungs are fine rather. Heart is slowed. Can we do a blood test? No, we have to do an ultrasound first. Alright, sir. Let's see. No abnormalities. One more test here. I don't know if I have to do both of them, but I did. No abnormalities. Let's do some blood. Yeah, see, I did both of them because, like, this is a heart and this is a heart. So I figured you would have to do both of them. I don't know though. I have no clue. All right, let's do some blood test. I'm just gonna take a little bit of this blood, all right? Thank you. I will send it to the lab. Get our results. Right here. I mean, everything's fine. Everything is fine with his blood. So it's not that. Okay. All right. Let's do an EKG. Yeah? Oh, wait a minute. Yeah, let's do an EKG. Okay, since we're right here, let's connect these, sir. We're just gonna connect these little stickers, basically. And then we'll connect some wiring to it, and we'll take an image of what's going on in there. Or not an image, I guess. It's a recording. Alright, show it. One clearly recognizes a slow heartbeat. Alright, this seems very, like, just similar to the last one. Right? Slow heart rate. It's probably gonna be the same thing. Let's go for a CT scan. Sir, we're gonna... What is this? Move the stretcher? Oh, the electrodes. Sorry about that, sir. Good thing you don't have any chest hair, because this would hurt. Trust me, I know. Alright, we're gonna take you out of here. We're gonna go for a CT scan, okay? Oh crap, we're stuck. We're absolutely stuck. Sir, I am so sorry. But we're stuck. I need a doctor. I mean, not a doctor. I need some help. Crap, dude. We're freaking stuck. Oh. I'm doing something. We're getting somewhere. We're moving. Oh, here we go. My goodness, sir. I am so sorry that happened. That's never happened before. It will never happen again either. Oh. There we go. Let's do a wide turn right here. Okay. Alright, sir. You just hang tight, alright? Let's do a CT scan. Alright, we're complete. Alright, let's check out the report. No abnormalities. Interesting, okay. Alright, CT scan. No abnormalities. So it's gonna just be a slow heart rate. Is that it? Alright, treatment. Okay, sir. Do we have medicine here? I think we do. Let's get some adrenaline. And let's get a syringe. Okay, then we'll combine this stuff. Alright, sir, I'm just gonna inject you with some adrenaline, alright? There you go. Okay. Now, do we have a phone in here? No phone. Okay. Let's go to this phone. We need an intervention. Alright, sir, we're gonna transfer you, okay? I'm gonna take you to the elevator and we're gonna transfer you to the ICU. Don't worry, you're gonna make it. I promise. Alright, I'm gonna transfer you over to this fine gentleman. Alright, you have a lovely day. Alright, let's complete the treatment. Alright, man, what do we do with, like, the levels? I don't know. I don't think it really matters, really, what the levels are at the moment. Alright, we've got no patients yet. So how's it going? Is it a slow day or what? Never mind. I can't even take 2 seconds. What's going on? Tell me about him. The patient looks a bit pale. Alright, same old story, huh? How about the vitals? We know that... Okay. Is it the same thing? Are we getting the same thing? Alright, I'll take it from here. Can I just inject him with adrenaline right off the bat if I think it's... if I think it's what it is? Or am I gonna get sued for malpractice? Alright, sir. Let me ask you a couple questions, huh? You have any issues with your family? My grandma had heart problems. Do you have any pain radiation? No. Have you been bedridden? You have, okay. Do you have any physical trauma? No. Okay, do you have any blood clots? No. When you breathe, does it hurt? No. Are you excited or do you fear death right now? Okay. This really almost seems like the same things again. I feel like we've gotten the same issue three times in a row now. Bedridden due to fatigue, no physical trauma, no blood clots, breathing, chest pain not dependent, concerned, not fear of death. Okay. I mean, we're gonna go right for... We're going right for slowed heart rate. Okay. We'll do a physical inspection. Let's take his clothes off. We'll do a physical inspection. No abnormalities. We're gonna check his lungs. They sound normal. One clearly recognizes a slow heartbeat. Okay, yeah. So far this seems like the same issue here. Okay. No abnormalities. Slow heart rate. Lungs are fine. We're gonna do an EKG. Sir, I'm just gonna connect these little pads here. You don't have any chest hair like the last guy, so you're gonna be just fine. Let's go ahead and read these. One clearly recognizes a slow heartbeat. Okay, let's take note of that. EKG, slow heart rate. We're going to do an ultrasound. Sir, this little gel on here might be a little cold. Actually, it's not cold. It's warm. Now that I remember, it's warm. Yeah. I'm pretty sure it's warm. I think the jelly might be cold, but then the ultrasound tool itself might heat it up. I'm not too sure how that works. But every time I've gotten an ultrasound, it's always been nice and warm. Okay, let's do this one just in case. Alright, everything's looking good, buddy, okay? I'm pretty sure you need some adrenaline, but I'm not allowed to just go and do that. Let's get a blood test going here. Okay, we're gonna check your blood. Take one tube. Send it over to the lab. And we'll be right back with you. Alright, let's see. Blood, everything's fine. Just like I suspected. Now we're just gonna go for a CT scan of your chest, sir. Right this way. I think I'm getting better at moving the stretcher around. Alright, let's get him in there. I think he'll be just fine. We're gonna pump him with some adrenaline. And he's gonna be ready to take over the world. Isn't that how that works? Alright, let's take a look at it. Right here. CT scan. No abnormalities. Yep. That means he's, yeah, slow heart rate. We just need to, once again, do the adrenaline here. I wonder if the cases are tied to, like, your level. Like, because I'm still the same level, I'm just getting this, this situation here. It's my third one in a row with the same exact issue. We might hit level 10 here. Right? And when we do, we'll see if we get something new. Alright, sir, we're gonna transfer you, okay? I'm gonna take you to the elevator. Yeah, maybe at level 10 we'll get, like, different cases. Alright, sir. We're at the elevator. I'm gonna pass you off. What's this guy's name? We'll call this guy Jerry. Okay, I'm gonna pass you off to Jerry. He'll take care of you. Oh, so we're already level 10 now. Okay. New patient in the waiting area. Alright, what's going on? Tell me. Patient looks like... Oh no, is it the same one? Increased respiratory rate and decreased oxygen. Okay, maybe this is different. This might be different. We alerted to reports of shortness of breath. The patient reports primary feeling tightness and pressure in the chest. Okay. Yeah, this one seems different. Sir, would you follow me, please? We're gonna go to room A22, okay? Right in here. Okay? God, go in there. Get undressed. Get on the stretcher. Alright. Sarah, I'm gonna ask you some questions, if you don't mind. Do you have any family issues? Not that I know of. Okay. Do you have any pain radiating today? Not in the arm, but a bit in the back. Okay, have you been bedridden lately? Sorry. I am not bedridden, okay. Do you have any physical trauma? No. Do you have any blood clots? No. When you breathe, does it hurt? No. Okay, and are you excited or fear of dying? I'm a bit tense because I've been having difficulty breathing for some time. Okay, thank you for answering those questions. That's very helpful. No heart disease. Pain radiates in the back. Not bedridden. No blood clots. Or sorry, no physical trauma, no blood clots. Chest pain, not dependent on breathing. And then concern, not fear of death. Okay. Okay, yep, so these are all different. Interesting. So he has back pain and he has chest pain when he breathes. I have no idea what that is, but maybe he's got pneumonia. Let's check out pneumonia. Well, sir, I'm gonna take off this Johnny that you have on here. Okay, and I'm going to check your lungs and your heart. What is that? There are whistling, buzzing noises to be heard. The heart sounds unremarkable so far. Dang, okay, stomach? That sounds normal. Okay, so his lungs, whistling and buzzing. Heart is fine. Let's go ahead and do a blood test on this gentleman. Sir, I'm gonna draw some blood, okay? There we go. I'm gonna send this over to the lab. Alright, let's check the results here. Everything's in the green. Alright, so that's fine. Normal range. Let's do an ultrasound. I mean, shouldn't we do an ultrasound of the lungs? Considering his lungs were like all wacky. They were whistling and buzzing. I might just do one anyways. I mean, not that it didn't say anything, but I think there were no abnormalities, right? I think that was correct. Alright, let's go do an x-ray, okay? We're gonna take you to the x-ray now. Alright, just wait right here, sir. I'm gonna go in the other room. Okay. Checking for pneumonia. Back pain and chest pain when he breathes. Alright, let's see. What do we got here? X-ray. Looks like emphysema in the lungs. Okay. X-ray. Diagnosis concluded. Okay, what about COPD? CT scan. Let's go. Let's take him in for a CT scan. It's right here. Sir, we're just gonna go... What's that noise? Sir, we're gonna go in the other room, okay? Gonna do a CT scan next. Okay, same deal, okay? I'll be on the other side of the window. You know what's interesting? We haven't had an emergency in a while. We only had one emergency. Not that I want an emergency. Alright, CT scan. Looks like emphysema in the lungs, yeah. Okay. Emphysema. Let's go back, so it is COPD. What's the treatment for that? Registration aftercare on the phone. Treatment? Okay. So there's like nothing I do for that. Oh, I do, okay. Take out these tablets from the cabinet. What does that even say? Formoterol? 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 I don't know. Alright, let's give them to him. Sir, look, you're gonna take some of these, and then we're gonna send you off somewhere else. Okay? Oh, we are doing some care for him right now. Okay, sir, I'm gonna give you an oxygen mask, okay? I changed my mind. I don't trust the other doctors, so I'm gonna take care of it. Let's get him in here. Oxygen mask. Oh, we already have it, okay. There you go, sir. Oxygen. Okay. Now what? Artificial respiration of the patient. Okay. How do we do that? Oh, right here. Okay, we have to be on this side. Okay. Advise the patient of the next steps. Okay. Sir, listen. You have been diagnosed with COPD, okay? A chronic lung condition. Alright, yep. We're gonna transfer you to aftercare because I couldn't read that paragraph before it left, okay? So, we'll take you to aftercare, don't worry. Sir, do you want to put your clothes on? Okay, I'm sorry. I keep forgetting to do that for the patients. Put their clothes back on. Okay, sir, we're gonna take you to... I think his name is Jerry. Yeah, I think it was Jerry. We're gonna take you to Jerry. He's gonna be in the elevator. Didn't I inform him? Yeah, okay. I thought I informed him already. Alright, here's Jerry. I'm gonna pass you to him. You're in great hands. Okay? Alright, treatment complete. Oh wow, we're level 13. I wonder what the levels do. If they actually serve a purpose. Alright, let's... How you doing? Tell me about him. The patient looks pale, but no external injuries. How about the vitals? Low blood pressure and increased pulse. Okay, we were called due to chest pain. Additionally, the patient is having difficulty breathing. Okay, I'll take it from here. Yo, what about, like... We have all these, like... difficulty breathing. What about, like, gunshots and stabbings? Like, where's all that at? I'm looking to be a trauma doctor here. Alright, ma'am. Does your family have any issues? Could be. I think my paternal grandfather died of a heart attack. Okay. And do you have any pain today? No. Have you been bedridden? No. Just crazy busy at off. Okay. I don't really care about that. Do you have any physical trauma? No. Okay. Do you have any blood clots? Well, I'm not aware of anything. Okay. When you breathe, does it hurt? No. Wait. No, that is totally constant. Oh, okay, so it always hurts. I think that's what she was saying. Alright, are you excited or fear of dying today? Well, it would be really bad if something serious. Alright, lady, look, I ain't got time. I ain't got time for all this, extended answers here. Alright, so we got no cancer with heart disease, no pain radiation, no bedridden, no physical trauma, no blood clots, chest pain not dependent on breathing, and suffers from fear of... Oh, she does suffer from fear of death. My goodness, lady. Pain. Oh, no pain radiation, sorry. Okay. Maybe she's just having a panic attack, huh? That might be it. Let's check. Let's check compressions here of the thorax laterally. Whatever the hell that means. Alright, ma'am, I'm gonna have to take off this, this Johnny you have on. And I'm gonna have to inspect you. There are no noticeable abnormalities externally. Okay. Compression, how do we do that? Compression. I don't actually know how to... I know I did it before. Oh, right here. Compression of chest. Feels normal so far. No pain reaction from the patient. Okay. No abnormalities. Let's go ahead and check the heart and the lungs. Okay, sounds normal. Let's do the heart. Okay, heart sounds good. We'll just do the stomach while we're here. Sounds good, okay. Both of them were fine. Now, let's go ahead and do some blood tests, yeah? Ma'am, I'm just gonna take some blood, okay? Thank you. I'd send that to the lab. And check the results here. Blood test. Okay, everything's fine. Everything's fine. Let's go ahead and do a CT scan. Ma'am, we're gonna take you over to the CT scan room, okay? Oh, sorry. Crap, we're stuck again. My goodness. Jesus. Okay. We made it. Oh, sorry. Oh, sorry. We're probably gonna have to do a CT scan on your brain after this. From all these collisions. Okay. Man, I feel bad for all the... You know, it'd be crazy if they actually add that. Like, you can add to their injuries. That would be wild. Alright, let's check the results here. CT scan. No abnormalities, okay. So it's not panic attack. Oh, it is panic attack. It is? Why? Oh, is it just because she passed everything except for she fears death? Is that why it's a... Is that why it's a panic attack? Okay. Let's register the patient for some aftercare on the phone. And then we're probably going to give her, what, some medication? Aftercare. Take out the lorazepam. Okay. Oh, is this like a Valium or something? Here you go, ma'am. We're gonna give you some drugs, okay? Some good drugs. Advise the patient on the next steps. Okay, ma'am, we're gonna transfer you over, okay? As that medication, you know, calms you down a bit, okay? I'm gonna take you to my buddy Larry. He's at the elevator. Oh, I'm sorry, ma'am. Let me get you dressed. I'm so sorry. Okay, here's Larry. I'm gonna hand you off. Alright, Larry, we got another one. Alright, treatment done. And that's that. Do I ever get a break? Do I ever get a break in this place, huh? Working my butt off. Alright, tell me what's happening. The patient has a wound on the lower leg. Oh, nice. Are they get shot? The vital perimeters are still within normal range. Only the blood pressure is somewhat low. We were called to an injury on the leg. We were already able to stop the bleeding. Alright, I'll take it from here. Let a professional take over. Sir, what happened to your leg, huh? Your wife cut you? Hmm? She catch you cheating? Is that what happened? Alright, sir. I'm gonna ask you a few questions, okay? Don't worry, I'm not the cops. Do you have any family illness? No. Do you have any pain radiation? No. It's all at the wound. Okay, makes sense. Have you been bedridden? No. Do you have any physical trauma recently? Okay, just the leg, what just happened now? Okay. Do you have any blood clots? No. Okay. When you breathe, does it hurt? No. Okay. And are you excited or do you fear of dying today? Well, I'm a little worried that I might get infected. Okay. Okay. Alright. Relax. You're gonna be fine. Okay? Looks like no to everything here. Right? He has an accident. No blood clots, no dependency. And concern but not fear of death. Okay, everything seems good. Let's do a visual inspection. Okay, we're gonna take your clothes off. And we're gonna do a visual inspection here, sir. A cut. Okay. A cut on the lower leg. Okay, treatment. Administer painkillers. Alright, sir, don't you worry, okay? I got the good stuff. Ibuprofen. I guess it's not really the good stuff, but it's good enough. You know what I mean? It will get the job done. Alright, now we need to... we're taking out some... anesthetic. We need a syringe. And now we're gonna combine these. Okay. And then inject. So you're just gonna feel a pinch, okay? Alright. Take the disinfectant. I think I already have it. Give it a little squirt. Okay, now we're gonna sew that up real good, okay? Give it a nice sewing. Alright, sir. Alright, you shouldn't feel anything, okay? It should be numb. Gonna have to sew this up real good. There we go. Look at this. Perfect. Now I'm just gonna put a bandage on it, okay, sir? Make sure you keep this dry and clean, okay? I'm gonna give you a tetanus shot too, just in case. Okay, just in case. Alright. Tetanus right there. Let's get another syringe. Go ahead and combine that. Alright, sir. I'll give you your tetanus shot here. Okay. Inform patient about discharge. Okay, sir, you're actually able... You can go home, okay? You're fine. Okay. The treatment is complete and I can discharge you. Follow-up care. Okay. Treatment concluded. And he's gone. He didn't even say thank you. Alright, what's this? The next patient's already here. Oh my goodness. Alright, what's going on? The patient looks a bit pale, no external injuries. Okay. What about the vitals? Okay, elevated blood pressure. We were called due to headaches and dizziness. Alright, I'll take it from here. I'm a professional. Sir, nice to meet you. I'm Dr. Searchlight. I'll be taking care of you today. Lovely, lovely fish. That's a really nice fish tank. Okay, sir, this is the room. This is where you'll be taking your last breath. No, I'm just kidding. I'm just kidding. Okay, let me interview you. Does your family have any issues? Your grandpa had heart problems. Do you have any pain? Just dizziness and weakness. Okay. Have you been bedridden? Because you're tired and groggy. Makes sense. Do you have any physical trauma? No? Okay, do you have any blood clots? No. When you breathe, does it hurt? My complaints have nothing to do with breathing, okay. And are you excited or do you fear for your life today? It's worrying, okay. But no fear of death. Okay, makes sense. Makes sense to be a little worried. Okay, no cancer but heart disease. No pain radiation. Bedridden due to fatigue. Physical trauma, no. No blood clots. Chest pain, but it's not only when he breathes. And he's concerned, but not fear of death. Okay, sir. I'm gonna go on a limb here and say it's slow heart rate. Let me do a visual inspection of you, sir. Let's take that Johnny off. And let's... Oh, no, we gotta take those clothes off. And we're gonna take a look at you. Here we go. No abnormalities. Okay, no abnormalities. Next, we're gonna check your heart and your lungs. Okay, lungs first. Looks normal. Heart next. Okay, slow heartbeat. We'll check your stomach while we're here. Stomach sounds normal, okay. Slow heart rate. Lungs are fine. Let's go ahead and do an ECG. So I'm just gonna stick these pads all over you. Got a lot of hair on your face, but none on your chest, so you're gonna be just fine, okay? It's not gonna hurt. Alright, let's read this. One clearly recognizes a slowed heartbeat. Okay. Slow heart rate. Let's go ahead and do an ultrasound. There we go. No abnormalities. Okay, so let me take these off. Don't need those anymore. Okay, no abnormalities with the ultrasound. Let's go ahead and do some blood work. Okay, just gonna take one tube here. And we'll send this over to the lab. Okay, let's check those results. Everything's good there. Okay, all in the normal range. Let's go do a CT chest scan. Okay, sir, we're just gonna go in the other room for a CT scan, okay? You ever have one of those? You'll be fine. Okay. So if this is the same as the others, it'd be kind of unfortunate that we've had 4 of the same, like, issue. It would be nice if there was, like, more cases, you know? Yeah, see, I knew immediately that it was the slow heart rate because it's the 4th time I've had it. Alright, let's do treatment. Sir, we're gonna give you some adrenaline, okay? It's gonna be great. You're gonna love it. Okay. Gonna just go ahead and inject you. Okay. Now we're gonna register you for an intervention, okay? No, it's not for your drug problem. It's for the, your other problem. Inform the patient. Okay, sir, listen, I'm gonna transfer you to intensive care unit, alright? You're gonna be just fine. And I'm gonna take you to the elevator now, where Jerry will take you there. You're in great hands with Jerry. Oh. There we go. Oh, sorry about that. Here you go, Jerry. Okay. Can we walk around? Not really, huh? Can't really go anywhere else. All the doors are locked. Alright, let's go ahead and complete that. I am an assistant doctor. What? I'm not an assistant doctor. I'm a doctor. Alright guys, I think that's actually going to do it here for our first look at Emergency Room Simulator. It started off a little rough. The beginning with the overload of information was a bit for me. But I pretty much know how to do everything now. It's all very clear to me. After doing it a little bit, it was much clearer. And I think maybe that's just me because I learn better when I actually do something, so when they're just overloading you with information, it's not good for me. I like to actually do it. But yeah, overall, the game's fun. I had a good time playing. I'm gonna keep an eye up for like updates of the game, see if they improve some stuff, and then maybe we'll play it again when they update it a bit. But overall, fun game. It was cool. So thank you all for watching. I'll be back again later on today at 8 p.m. Eastern for our second stream of the day. We stream every single day of the week, twice a day, 11 a.m. Eastern and 8 p.m. Eastern. So that's going to be it. Thank you all for stopping by. Thank you for watching. Thank you, thank you, thank you. Enjoy the rest of your day, guys. Bye. See you later.